Now let's talk about toddlers and preschoolers. Again, not a large demographic of the patients that we deal with, but there are some special challenges as an EMS provider that you're going to be faced with this age group. First off, now we're seeing a lot of separation anxiety that goes along with this. So whereas if you had a newborn or an infant, they were difficult because they couldn't communicate, because you couldn't really find out what was going on, you couldn't ask them questions. But now we're also looking at the fact that you're stranger danger when it comes to dealing with these patients, and they're going to be very clingy or have that separation anxiety with their parents or their caregiver as you're trying to provide care. Also understand the fact that you're not going to be able to speak to them in terminology that you're used to. You're going to have to bring your terminology down as far as your therapeutic communications that we've talked about before. You're going to have to target it for the age demographic that you're working with. So in this case, large words, things that have multiple syllables, medical terminology is not going to be understood by this demographic of patient. So let's take a look at what some of the other norms are, and then we'll move on from there.
Toddlers and preschoolers. A toddler is considered age 1 to 3. Some of the changes that we see physically: pulse rate 90 to 150 beats a minute, respiratory rate is 20 to 30 breaths a minute, systolic blood pressure is 80 to 100 millimeters of mercury, and their temperature is generally 96.8 to 99.6. A toddler's lungs continue to develop more terminal bronchioles and alveoli. For preschoolers, age 3 to 6 years, the pulse rate is 80 to 140 beats a minute, the respiratory rate is 20 to 25 breaths a minute, the systolic blood pressure is 80 to 100 millimeters of mercury, and their weight gain should level off. Although toddlers and preschoolers have more lung tissue, they do not have well-developed lung musculature. This anomaly prevents them from sustaining deep or rapid respirations for an extended period of time. The loss of passive immunity is possibly the most obvious development at this stage of human life. Colds often develop that may manifest as GI distress or upper respiratory infection. Neuromuscular growth also makes considerable progress at this age. Toddlers and preschoolers spend a great deal of time finding out exactly how to use their expansive nervous system and the muscles it controls by walking, running, jumping, and playing catch. At this point, preschoolers will have a brain that weighs 90% of the final adult weight. Physiologically, toddlers have the neuromuscular control capable for bladder control by 12 to 15 months. However, the child may not be psychologically ready until 18 to 30 months of age, and the average age for completion of toilet training is about 28 months. Teething also occurs in this time frame. Psychosocial changes that occur. This period of development is often exciting for parents. Toddlers or preschoolers learn to speak and express themselves. By 36 months of age, basic language is mastered. Interaction and playing games with other children begin, and by 18 to 24 months, cause and effect begin to become understood. Children learn to recognize sexual differences by observing their role models.